According to the last or previous question about a 53-year-old woman who comes to the office for removal of multiple nevi on injection of lidocaine, which of the following signs and symptoms is most likely to suggest lidocaine toxicity in this patient? It is not bronchospasm, it is not hypertension, it is not tachycardia or urticaria, it is tinnitus. Because signs and symptoms of lidocaine toxicity include dizziness, agitation, lethargy, tinnitus, metallic taste, perioral paresthesia, slurred speech, euphoria, hypotension, and bradycardia. Bradycardia is not a sign or a sign of lidocaine toxicity. Bradycardia, tachycardia is not a sign of lidocaine toxicity. Bradycardia is more common, and bronchospasm and urticaria are not signs of lidocaine toxicity. Uh, Another question, I'm trying to make a review for you about those questions. Um, uh, A 62-year-old woman who is undergoing excision of a ganglion on the dorsal wrist with lidocaine wire block. During the procedure, she says she feels pain, becomes restlessness, progressively develops a metallic taste in the mouth and has ringing in the ears. Which of the following is the most appropriate management? We had First, administer diphenhydramine intravenously and continue with the procedure. Decrease the tourniquet pressure by 50 mmHg to ease the tourniquet pain. Deflate the tourniquet completely. Wait a few minutes to uh, ref, uh, reperfuse the arm. The exsanguinate and reinflate tourniquet, inject bupivacaine, marcaine locally to help with the pain and continue with the procedure, and either is maintain an airway to and administer oxygen. The choice was E. The clinical scenario describes tourniquet cuff leak leading to lidocaine toxicity. Factors that predispose to cuff leak during Bayer block. Anesthesia include obesity, funnel-shaped arms, and the hypertension. Initial signs of lidocaine toxicity include anxiety, tinnitus, and perioral numbness, muscular twitching, seizures, and respiratory or circulatory arrest, and may develop later. Critical initial management include maintenance of the airway, oxygen ventilation, and intravenous fluid administration. Administering diphenhydramine intravenously and continuing with the pressure is inappropriate. Diphenhydramine should not be administered because the patient's symptoms are not considered with an allergic reaction. Deflating the tourniquet completely, waiting for a few minutes to perfuse the arms, then extricating and re-inflating the tourniquet and deflating the tourniquet by 50 mmHg to ease the tourniquet pain are both inappropriate. Deflating the tourniquet will worsen the patient's condition by increasing the serum concentration of lidocaine. Administering bupivacaine marcaine locally to manage the pain and continuing with the procedure is inappropriate because the underlying problem is not incisional pain. Continuing with the procedure without addressing the patient's Distress may lead to the development of more serious complications. According to another question uh, of a 50-year-old woman who is obese undergoes carpal tunnel release using a lidocaine buyer block for anesthesia. During the procedure, the patient became restlessness and complaints of a metallic taste in her mouth and ringing in her ears. As the tourniquet is rechecked, the patient began having seizures. Which of the following intravenous is the most appropriate next step? Administer intravenous fluids, administer intravenous lidocaine, administer intravenous thiopental, establish an airway, and hyperventilation with oxygen. The correct answer is D. Establish an airway. The patient described has experienced a cuff leak leading to a local anesthetic toxicity. At lower dose, most toxic reactions involve the central nervous system in a biphasic fashion initially. There is an excitatory phase that manifests as muscle twitching in the face and distal extremities, followed by ex- uh, tremors and progressing to generalized toxic clonic seizures, with further increases in anesthetic. A depression phase follows with drowsiness, unconsciousness, and respiratory arrest. Treatment of patients who demonstrate systemic toxicity with convulsions first requires the establishment of a secure airway followed by hyperventilation with oxygen. So, first of all, we should establish the airway before we make hyperventilation with oxygen. This often terminates the seizures by reducing arterial CO2, preventing the cycle of acidosis, increased local anesthetic uptake by the central nervous system, and lowered seizures threshold. If seizures continue, 50 to 100 milligram intravenous sodium thiopental may be terminate the convulsions, but we can't begin with administration of intravenous thiopental first. Cardiovascular toxicity usually occurs at higher anesthetic blood levels. If there is hypotension, however, intravenous fluid elevation of the legs and vasopressor support should correct it. If bupivacaine was used for the block, bupivacaine induced arrhythmias are not extremely responsive to intravenous lidocaine because of its recognized cardiotoxicity and reports of several defects following its use. Bupivacaine is no longer recommended for use in buyer's block. Obesity, particularly in patients with funnel-shaped arms, may complicate with establishment of good tourniquet, conclusion and buyer uh, occlusion and buyer block anesthetic. The selecting another method of anesthesia in obese patients may be prudent to avoid potential local anesthetic toxicity associated with tourniquet leak. This is according to the question. So continue with the questions, but I am trying to choose the questions. Uh, there is a question about uh, embolism. We will talk about it later, and there is compare of two questions about the embolism or pulmonary embolism and what we should do. And there is a question about we talked about it, poor thumb opposition, and there is a patient of we talked before about herb transplantation over a scar, even in the scalp, and there is a question now. Uh, There's a question now about a previously healthy 38-year-old woman who has onset of a brief clonic seizures 30 minutes after lidocaine-based tumescent anesthesia, which is administered during a large volume liposuction of the abdomen, hips, and thighs. After 3 minutes, she has onset of asystole and cardiopulmonary uh, and cardiopulmonary resuscitation is initiated. She is unresponsive to the standard ACLS resuscitation protocols for asystole administration, of which of the following is the most appropriate next step. Uh, is it dantrolene? Is it dimercaprol, dimer, caprol, or lipid emulsion, or an acetylcysteine, or naloxone? The option is lipid emulsion. And there is another question about a 23-year-old woman who weighs 65 kg undergoes awake liposuction in an accredited office-based procedure room. You should notice in about that accredited office-based procedural room with a registered nurse and a surgeon. She was preoperatively treated with oral alprazolam 1 milligram and intramuscular uh, merpidine 50 milligram intraoperatively. The patient is given tumescent lidocaine solution to 45 milligram per kg. During the procedure, she reports that she is experiencing a metallic taste in her mouth and has a numbing sensation in her lips. 15 minutes later, she exhibits abrupt signs of confusion and agitation. Her, uh, her blood pressure has fallen to from 125 on 88 to 95 on 60 mmHg, and her heart rate has increased from 80 bpm to 108 bpm. Which of the following is the most appropriate initial management of this patient? Is it first administer flumazenil 0.2 milligram intravenously over 15 seconds, administer of intramuscular injection of naloxone hydrochloride to the thigh, administer 20% lipid emulsion bolus 1 0. ml intravenously over 1 minute. Secure the airway. This is option D. Secure the airway to maintain oxygen and prevent hypoxia and acidosis. E. Stop the procedure and call for help. The correct answer is E. Stop the procedure and call for help. Securing the airway will be later. Uh, Securing the airway and to maintain oxygenation and prevent hypoxia, and because they are talking about hypoxia and acidosis, which will become later, and administering of 20 uh, 20% lipid emulsion bolus 105 ml per kg intravenously over a minute. It will be later, and the other options will be later. So another questions to compare between them. Uh, I'm trying to look about that. I'm trying to look about that. There are another ones later. We can speak about the vagina uh, um, and reconstruction of the vagina, and there is another questions. Still I am watching about vagina and about the mallet finger and about the laser and nevus of aorta. Please, I apologize for this bad uh, videos, but I mean not too much light, but later I will try to be more professional about that. I wish that you subscribe. Please concentrate about the questions and the value of the questions more than the other things, and share this video with your friends who wants to submit to plastic surgery exams. Subscribe to my YouTube channel, please. Make like, please. Thank you.